You, as always, have been one of the most outspoken voices in the city on health matters, and you've been especially critical of late on the response to monkeypox. It's left many, largely members of the LGBTQ community, unable to get the vaccine and having to endure hours of red tape when they do need treatment, when they're diagnosed. The city got 14,000 doses. Those were gone in 8 minutes. Now we're getting 25,000 doses. Is this finally showing the urgency? Are we there yet, taking this seriously enough?
We are not there yet, I'm afraid. And it's really frustrating that we're seeing some of the same mistakes repeated again with the shortage, not just of vaccines, but also of testing capacity and of treatment, the same mistakes that we made 2 years ago with COVID. New York City is now recording over 30% of the cases of monkeypox nationally. We are the epicenter of monkeypox, actually specifically Manhattan, but New York City as a whole. The city's only getting 10% of the vaccine supply. And it's that mismatch which is really hurting us. It's why a week ago we had over 9,000 appointments go in something like 8 minutes. The demand is huge and we're not meeting it yet. Now, the most recent supply of about 26,000 is another step in the right direction, but still we're probably not even at half the level that we need just to serve high-risk people and treatments as well. So we've got to do much more. Look, it is true that this outbreak has been almost entirely concentrated amongst gay, bisexual, and men having sex with men. But this is a disease that anyone could catch and spread. And so we just want to make sure that we address this now before it really gets out of hand.
So I understand the federal bottleneck that you're talking about. It doesn't seem like anything or really anything that we can control locally, but is there more we could be doing locally? I think I've heard you talk about pre-registering people and some other organizational things that we could be doing better, yes?
Yeah, the current system, which requires you to know at a certain time, appointments are going to post, you have to be on the website, you're hitting refresh constantly. That's hard for someone who doesn't have internet or who has to work during odd hours. And it's led to some inequality in who's getting vaccinated. We don't actually have data yet on who's being vaccinated in New York City, which we need to see. But anecdotally, it's pretty clear that gay men of color are not being adequately served right now. It would be much simpler if we just had a pre-registration list where anyone could add their name anytime, day or night. You could even have a phone number for people who don't have internet. And then you could make sure that the appointments for vaccination are spread out evenly among zip codes around the city for equity. And then you could just have a lottery so that people could know that, okay, my number's up, I have an appointment slot. It would be less stressful and more efficient. Some other cities have done this. Washington,
DC, correct? Yes. Yep, you just said it.
Yeah, exactly. We should do it here in New York as well.
I want to move on to COVID real quick because we have BA.5 surging. Hospitalizations are going up, though not as quickly as we've seen during previous surges. But last week, Governor Hochul affirmed we really wouldn't be seeing any sort of new restrictions or mandates as we moved into the fall. Again, the urgency question, are we showing enough urgency? Do we need to see more mandates or restrictions? Your thoughts?
Well, we have many assets we didn't have even in the Omicron stage. We have wide availability of treatments like Paxlovid, and we have more immunity as a population from vaccination and from so many of us who have gotten this virus. But we are in a wave. There's no doubt. We are in a BA.5 wave. And the news that this week President Biden has contracted COVID is just a reminder that the threat is still real. And thankfully, while hospitalizations are increasing, we're not seeing such a rise in ICU or deaths. But even at the current pace of about 10 deaths a day, that just for New York City, that makes COVID one of the most deadly diseases, definitely top 10, more than diabetes or kidney disease. And just like we take actions to minimize deaths and risk for all those other diseases, we need to do it for COVID as well.
On COVID, though, the city has pulled back PCR testing sites, saying they're favoring a home testing strategy. But whenever you ask the health commissioner about what do you do if you're not sure about this or that, he says, go get a PCR. Those two things don't seem like they line up. Are you concerned about the lack of PCR sites as we hit this surge?
Testing is extremely important right now. There are cases where you need a PCR test. I would like to see a reversal in the sites being closed. But really, home tests are going to be the main option for people in more than 90% of cases. We need to do more to get people home test supplies. Everyone should have a stash at home. We need to restart vaccination. We've had pretty much vaccination boosters have come to a halt. We need to get that moving in the right direction again. We need to make high quality masks more readily available everywhere for free. There's more that we can do. We need more attention to this, not because this is cause for panic, but because it's a disease which is spreading and we need to do more to contain it.
Manhattan Borough President Mark Levine, thanks again for coming back on Picks on Politics.